going to talk briefly about how we can use simulation, how we can use the recreation of clinical events to design, to train, and to excel in the context of MHP, but really how we deliver this for the care of any patient that requires blood products. I think when we talk about simulation, this is what people think. They think that it's going to be money, it's going to be time, it's going to be effort. We don't need $100,000 mannequins. We don't need expensive sim programs. If you have it, that's great. But I think what we need is just creativity. I think each one of us, when we're calling for blood, we've activated an MHP, we think, boy, I didn't realize that might impact the patient, that this particular element may actually hinder the way that that blood or blood product is getting to the patient. We need to be able to experience a protocol. And so we've done this at St. Mike's. In fact, we run these regularly. We use simulation to design our MHP, and we identify problems along the way. We've done simulations for the last 10 years at St. Mike's, not just in MHPs, but we have shown reduction in costs for a particular project. We can improve efficiency. We can decrease development time of protocols. Essentially, we can distill it down to making better decisions faster. And so you can use it to design, train, excel. I think the future is simulated.